Hi, everyone. I'm Linda Golick. I'm the Health and Wellbeing e-marketing strategist in business and community health at Bellin Health. And I am so happy to be joined today with Dr. Brad Burmeister. Thanks for joining us, Dr. Burmeister.
Thank you for having me.
Well, I'm so excited to have you today because we want to really dig into some of the questions that people have surrounding the vaccine. And we know how important it is to educate everybody and make sure that everybody's really getting as much information as they can. So this is a list of different questions that we've received, and we're just going to kind of go through and answer your questions today. So let's start out by talking about the technology behind this vaccine. I think it's really fascinating. And if you could just kind of break that down and explain how that's working in this vaccine.
Right. So the Pfizer and the Moderna vaccine both use what we call mRNA technology. The M stands for messenger RNA. This is actually a bit different than DNA, which most people know what DNA is. So if you remember back to high school biology, DNA gets transcribed into mRNA, and then mRNA goes to something in your cells that makes it into a protein. So the messenger is the messenger that is between the DNA and that protein your body's going to make. mRNA vaccines actually have been around for a while now. We've been studying these for about a decade. They've been trying to understand if they can be used for cancer vaccines to prevent cancers in the population. So mRNA vaccines are not really new. And we're really lucky that they've been doing this research because we had this mechanism or this vehicle to deliver some information to our cells that really hasn't been used widely before in humans. And all we really needed to get this vehicle or this new type of technology to work was some genes. We needed to get the code to the DNA and therefore the mRNA of the COVID-19 virus. So once we had that information, the scientists essentially picked a protein that was specific to COVID-19. That's the spike protein, which is important for delivery of the infectious molecule to your cells, and give that information to your body to make that protein structure and have your body attack it and make an immune response to it. So we know that mRNA technology is safe. It's not something that's brand new. It is the first time it's being widely used in people. We also know that mRNA can't affect your DNA. It can't go and change the DNA that's in your cells and change essentially who you are because it's the middleman between your DNA and your protein. It doesn't go backwards into DNA. That's just not possible. And actually, in vivo or in your body, after we give the mRNA, it only hangs around for a very short period of time. And then it's just completely degraded and your body gets rid of it. So it's not hanging around for really any more than maybe even a day or two. I think the other important thing to mention is that with the clinical trials that were done, there's a lot of hype out there that these trials were rushed and happened very, very quickly. And these did happen very fast, but part of the reason they happened so fast was one, that we had this technology all already available. But also a lot of the trials were run at the same time versus from end to end. So typically we have, a phase 1 trial that's essentially looking in animal studies, and then a phase 2-3, which is looking at efficacy and safety in human patients. And these trials really, phase 2 and 3, a lot of them happened at the exact same time. They were doing the safety and the efficacy trials, or how effective it was with the same population, instead of studying safety first and then studying efficacy. So that really rushed things by probably months and even years that we were able to get this done so quickly.
Perfect. And I love the explanation of it being the middleman. It's kind of the middleman. It's not changing anything. Great.
Right. It's just the messenger.
So let's talk about the side effects, because I know folks are a little bit worried with some of the reactions that we've heard about. We've heard some people are asking about it, Bell's palsy being a side effect. What do we know right now about side effects?
Right. So we do know that with most vaccines, including influenza and the tetanus vaccine, that people often do develop side effects to it. And a lot of those side effects really are the vaccine just working and doing its job. You get muscle aches and pains, sometimes a low-grade fever, a headache, because your vaccine is stimulating your body's immune system to have an immune response. It's making you feel like you're sick because your body's fighting that spike protein particle that it's making. to develop that immune response. It's really interesting if you look at the FDA documents and the Pfizer research and Moderna research data. When they do these large-scale studies of 40-some thousand patients each, half the people get a placebo, or essentially probably like normal saline, or if it's a pill, typically it's like a sugar pill, and the other half get the actual vaccine that's being researched. And when you look at that data, even people who are in the control group, or the people who got the sugar pill or the placebo, several of those people reported that they got symptoms from the vaccine because they were blinded. They did not know if they got the placebo or if they got the treatment. And when it comes to the Bell's palsy, the reason we don't have a warning on this is that the number of people that we would expect in the general population to develop Bell's palsy over a period of time is the same as it was in the people who received the COVID-19 Pfizer vaccine. So it doesn't seem to actually be a side effect of the vaccine. It seems just to be something that we would expect to happen at random for someone who's just living their life in the general population, if that makes sense.
Yeah.
At the same time, we also know that, the first vaccine sort of is a primer for your body. It's introducing this spike protein vaccine to your body, and your body's starting to make a little immune response. It's recognizing a little something's there that shouldn't be. And then your second shot really is sort of a booster. Your body has some memory of that it's there. So a lot of people are saying that they get more significant response or side effects to the vaccine the second time around. So maybe they have a little bit higher fever, have a headache, or chills seem to be the most common side effects. So they are out there. I've heard some of my partners and people that I know across the country actually wish that they got at least some side effects so that they knew the vaccine was working in their body and doing its job, and that they would feel more comfortable going out if they maybe had a little chills for a day after. And everyone that I've heard who's had side effects says they've been easily treatable, just like with time, or just Tylenol or ibuprofen, and given it 24 hours.
Great. Good to know. Good to know. Very normal, not scary, type side effects. So let's talk a little bit about what is actually in the vaccine. I think it's fascinating that when people are creating a vaccine, what needs to be in there? What kind of ingredients does it contain?
Yeah, so that's a great question. I know there's a lot of concern about what's in vaccines, and you always hear about mercury and weird things like that. So I actually pulled up just the data sheet, right from the FDA. And really, there's not that many ingredients in it. The first is the mRNA, which is made of ribonucleotides. Those are little pieces of molecular genetic information that, again, is not DNA. Next, there's like a lipid type particle, and this is really a delivery molecule for the mRNA. So the mRNA can actually get into your cells, because without it, the mRNA would just dissolve and disappear really quickly. It'd break up into little tiny components that your body would no longer recognize. And then there are a bunch of things that are like similar to electrolytes. There's some potassium, there's some sodium chloride, which is like normal saline. There's some sucrose, which is sugar. These are stabilizing things that just help deliver that into more of a liquid form than a lipid form, which is more like a fatty molecule. And then lastly, there is another molecule in there that is a stabilizer and a delivery vehicle called polyethylene glycol, which is actually similar to Miralax, which is sometimes we treat constipation with. And it's interesting to note, they think, preliminarily that perhaps that molecule, that PEG molecule, as we call it, might be responsible for some people having more severe allergic reactions.
Okay. Good to know. So what if somebody suspects that they have COVID? Can the vaccine make that any worse?
Yeah, so there is some concern initially that, there's some vaccines out there that if you give them a vaccine, it can actually make a pre-existing infection worse. We saw that actually with a previous infection called dengue fever. Where after you get a vaccine, it could actually amplify your immune system and just make you more sick in general. That was not observed with the coronavirus vaccine, and it's not really a concern that we have moving forward any longer.
Good. Great. Good to hear. So what ages are these vaccines approved for? What are we looking at as far as who's getting the vaccine right now?
So right now, one of the vaccines we're looking for 16 or older, and another is 18 or older. And those cutoffs are only because those were the people that were included in the research trials that were done. It was not yet studied in younger people. And actually, it's the same thing for pregnant women. We don't like to study pregnant women in early vaccine studies, but we do know that some people in the course of the study do become pregnant. So we just did not have a large enough population of people who became pregnant during the research trial to get meaningful data from that. And I think we're actually going to talk about that here later in our little question and answer session.
Yes, we certainly are, because lots of questions surrounding that. So do we know how soon after someone gets vaccine, the dose 1 or the dose 2, how soon are they actually protected from COVID-19?
So in those studies, there's this beautiful graph called a Kaplan-Meier plot. It's a technical name. It's really cool. But we start to see 2 lines on that graph that start to separate from each other. So essentially on those graphs, the higher you go, that's the more people in that group that became affected. So actually about day 12 after the first vaccine, we start to see those 2 lines separate. We see the control group, the people who got the placebo or the sugar molecule, that's nothing, continue to get infections at the same rate as they essentially did in the first 12 days. But we start to see the people who got the Pfizer vaccine start to separate at a lower rate of getting infected than the control group. So it's about day 12 after the first group, we start to see that. And then, just a couple of days, about 7 to 12 days after the second vaccine is really where we see that slope of that graph stabilize and stay about the same for the balance of the study that we saw, where we see that 95% effectiveness.
Okay, great. So pretty quickly after the vaccine.
Absolutely.
Great. So what do we know about the allergic reactions that we're hearing about? Do we know what people are reacting to? Do we know? What do we know about it, I guess, is the question.
Right. So we don't think that people are reacting to the messenger RNA itself. That would be very unlikely because your body has messenger RNA already in it. Your immune system's not going to attack something it already knows, or that's something that's already in you. But we think it's something called the polyethylene glycol. It's a little molecule that helps deliver the vaccine, the mRNA, to your body. We know that this is really rare. Some early studies were saying maybe 1 to 2 people out of a million. A recent CDC report said that maybe 11 out of a million doses of the vaccine, people will have what's called an anaphylactic reaction. We know people who are getting this anaphylactic reaction are people who have a history of having really severe reactions and carry an epinephrine pen, or EpiPen for short is the brand name, which we refer to it commonly. But those people seem to perhaps be a little bit more predisposed to having that severe reaction. You hear a lot of people, though, say that why would you take something that could potentially have a really severe reaction? Like, that's not safe. In medicine, anything we're doing, we're always trying to balance the risks and benefits. So we know that the risks for this vaccine, we've had no reports of someone having such a severe reaction that they didn't survive, a very brief hospitalization. Almost all people who have that severe reaction are able to be treated really quickly, maybe have a short emergency department stay and are able to go home. So we take a look at that number that the CDC is reporting of 11 in a million people having the most severe reaction to the vaccine that's possible. And compare that to if we had 1 million people in the state of Wisconsin get coronavirus, and you would see 10,000 die and 40 to 50,000 need to be hospitalized. So, that's really impressive numbers compared to the 11 people or so that would have the most severe reaction that we know about.
Absolutely. And I think that really answers the question of, is it worth the risk? And the risk is so small. In comparison, I love that data that you used. What if we had this many people get the virus? Absolutely.
Definitely. And just like the impact this has on our community, not to mention people are hospitalized and die, but, with our public health measures we're currently following to minimize the impact, the downstream consequences we're seeing on people's mental health, some schools are closed, and all the impacts that we have on businesses. So clearly the benefit of having a large population immune to COVID far outweighs this very small risk we have to the vaccine.
Absolutely. So do we know at this point, do we know how long the protection is going to be once people have the vaccine? Do we have any idea how long it's going to last? Will it be like a tetanus shot that you get once every 10 years? Will it be like a flu vaccine? Do we know at this point?
We don't yet have good data on that. Those research trials, they're going to follow people for upwards of 2 years. But at the same time, we've only been doing human trials for less than a year now. So it's really not possible to tell, is people who were vaccinated going to start to have coronavirus infections at a higher rate at some point in the future. We can extrapolate, if you will, from other viral immunizations that we have. And those seem to last maybe a couple of years, sometimes, around 3 years. So we expect you might have, more than a few months, which there's some rumors on social media going about that this is only going to last a few months and you're going to need a new one every few months. But we do expect it'll probably last several years. The exact timeline, really is uncertain.
Okay. Thank you for that. So a question we receive all the time is people questioning if they have had COVID, whether or not they should get this vaccine. What would you say about that?
We don't recommend that you get the vaccine if you are actively infected with COVID and you're still having symptoms. You should wait until you've recovered from it. But people who have had COVID should still get the vaccine. We've seen, really several cases now of people who've been COVID infected having a reinfection at some point after several months. Right now, the guidance is that if you've been infected in the last 90 days, it's unlikely you're going to get reinfected with COVID. But once that 90-day window ends, we start to see people, very slowly start to get COVID-19 again.
Okay. All right. So let's move to talking about the demographic of women and everything that comes into play with that. So we're getting a lot of questions on, and you referred already to pregnancy. People are also asking about if they're breastfeeding. There's some concern about the vaccine affecting fertility. What do we know about that right now?
That's a great, important question. We know that currently the FDA emergency use authorization does not approve the vaccine for pregnant women. And again, that's because pregnant women were not purposely studied in the clinical trials that were done so far. The FDA has very rigorous criteria of who they're going to approve, and they're not going to approve something that has not been studied in that subset of that population. We don't have any reason to believe, though, that this vaccine is going to negatively impact women who are pregnant or who are breastfeeding. And for that reason, we've seen the American Congress of Obstetrics and Gynecology, they go by ACOG. A lot of people probably have heard of them. That's the subspecialty group of OBGYNs across the country, say that the COVID vaccine should not be withheld from women who are pregnant or are breastfeeding because it is safe. And they think that the impacts of being infected by COVID-19 while pregnant, again, would outweigh the risk that the vaccine would have to a pregnant woman or the developing baby. We also know that the COVID vaccine does not impact fertility. I actually have no idea where this rumor came from. I think it was something that came from social media.
Probably.
But we have no information or even plausible idea of why it would impact fertility. So we think this is just a social media myth that just had propagated out there for really no clear reason.
Well, and I think this is a good reminder, too, to be having these conversations with your primary care provider. They're there. They know your health history. They know what you may have going on. And this is a great opportunity to have those conversations with them as well.
Yeah, absolutely. If you're pregnant, you should just discuss with your OBGYN whether or not the COVID vaccine's right for you when it becomes available.
Absolutely. Absolutely. So can you help us understand why there needs to be 2 shots with the vaccine versus the flu shot, which is one shot? Can you help us understand that?
Right. So we know that after round 1, we give your body a little primer. It starts to recognize that new protein, that spike protein, and develop an immune response to it. And then the second round is a booster to that immunity. Your body has a little bit of immune memory. And the second time around, it really makes a more robust response to that vaccine that seems to be likely to give you a longer lasting immunity and a stronger and more effective immune response. Now, I wanted to mention, too, I think I missed it earlier, that the COVID vaccine is, almost 100% effective at preventing severe infections. If we look at the people who got coronavirus, almost all the people who got COVID during the research trial received a placebo. And I think, just one person out of 120 who had a severe infection, only one of the 20,000 or so that received the vaccine had a severe infection and required hospitalization. So, it's almost universally protective against the severe infection, hospitalizations, and death in the study sample that was done.
It really is the answer to what we were hoping for. This was really what we were hoping for in the last 9 months.
Yeah, and honestly, this is better than we were hoping for. We were hoping for a vaccine that was maybe 70% effective, and when we found something that's 95% effective, that's just going to help us get towards that herd immunity that we need in this country and across the world to help COVID just go away.
Can't wait for it to go away, right?
Right.
We're all ready for that. So this is another social media myth that I just wanted to address. The idea that there's some kind of microchip or some kind of tracking device with it. And I feel silly even asking the question, Dr. Burmeister, but people are asking us this question. How do we know that there's no microchip within this vaccine?
There's no microchip in the vaccine. It sounds like that this social media myth actually came from an attack on Bill Gates. So if anyone who follows philanthropy knows that Bill Gates and the Bill and Melinda Gates Foundation have been incredible philanthropists towards vaccines and preventing infectious diseases, particularly in third world countries. Collaboratively, they've saved and impacted millions of people's lives by the vaccine research and distribution and supply chain management work that they have done. So it seems that the social media myth really came from a mechanism to try to attack Bill Gates and the work that he's done previously. I don't even know that it was meant to impact COVID. It just wanted to impact Bill Gates and the reputation that he has. So, it's totally off point. There's no microchip in the vaccine. I'm not a technology expert, but the amount of vaccine they put in your muscle is very small and it's a clear liquid. I looked in the bottles myself several times. And actually, for the Pfizer vaccine, 5 doses come in a single vial, and the nurse draws it up. And I'm just curious how they know if they're getting 1 microchip or maybe they're getting 2 microchips in the shot when they draw it up. Like how many microchips, I'm wondering, are in that bottle so that that one is getting in each vaccine when they draw it up.
Right. Exactly. Good point. Really good point. We've had a little bit of question about the effectiveness as far as where the shot is given. Is it really, really imperative that it goes in just the right spot in the arm?
So it's likely going to be most effective if it's an intramuscular injection, if it makes it into your muscle. If it gets anywhere in your body, not really your digestive tract, but if it gets into like a layer of fat, or something, it may have some immune response to it, but it's going to probably be the best delivery method if it's right into the muscle.
Perfect. And our people know what they're doing. They know where the shot needs to be put in for sure.
Yeah, absolutely.
So just a question surrounding treatment. There's some publicity about the hydroxychloroquine and then ivermectin as possible treatments for COVID. What do we know about those drugs?
Another great question. So hydroxychloroquine had a lot of excitement really early on in the pandemic. And the reason for that is that when they do in vitro models, that's like in a petri dish in the lab, hydroxychloroquine seemed to impact the ability for the culture of cells to get COVID-19 infected. So that's when you have just a petri dish, you give the petri dish cells, not a human, a petri dish, COVID-19, and they had hydroxychloroquine, they didn't uptake it. So after we do those early trials, then you have to do human trials to understand if it actually works in vivo or in life. And those studies did not pan out. Early on, we had emergency use authorization by the FDA to use hydroxychloroquine. And since then, the FDA has redacted or took back that, and it's no longer approved for use because several large human trials have shown that it doesn't do anything. And we know that some people who take hydroxychloroquine at the doses indicated for COVID-19 back then, that it can actually cause harm, mainly heart arrhythmias or abnormal rhythms of your heart that could be fatal. So that's definitely not recommended. I hear a lot of conspiracy out there on social media that it's just a cover up by the scientific community. And, I would just add that I myself was actually in a hydroxychloroquine research trial. I was in a study through the University of Minnesota for what they call pre-exposure prophylaxis. So that's taking hydroxychloroquine to prevent infection. And they were studying healthcare workers and whether or not if we took hydroxychloroquine, if the rate of COVID infection in healthcare workers was any different from people who were taking a placebo. And that research trial has been published now, and we know that it doesn't work for pre-exposure prophylaxis either. So the trial I was in showed that it is garbage and it does provide the risk. So, even with the vaccine, I know people who have participated in the research trial and who are physicians and, risked, their health and well-being to be part of that important research. So, our medical community is behind this. We want to get things moving forward, and, we're willing to be the research, vessel, if you will, to help get these studies done. Ivermectin is interesting to that as well. Has had a little bit more recent, excitement, if you will. But again, all of that research was done in a petri dish so far, where it showed that it was effective. The human trials have not panned out yet. And for that reason, the FDA has not given that emergency use authorization at this point. The human trials that I've seen have not been done very well. They're a bit flawed to get the results that they did receive. That wasn't intended by the researchers, but it's not a large population study like we've had with hydroxychloroquine or with the vaccines that we currently have that prove effectiveness. So I think the data is very weak. The strongest data is a petri dish, which we know does not always pan out to humans. And we really just want to caution people because ivermectin is commonly used in animals. It's usually used more for like worms, to treat worms. And we know that there's people out there who are taking veterinary use ivermectin to try to prevent COVID. And we never recommend taking something that's intended for animals as a human product. So, we just need to be very careful with the messaging that gets out there on social media because we have seen people taking all sorts of things. Early on, we heard people were confusing hydroxychloroquine with another medication that's out there, and they were actually dying because they're intended to try to prevent COVID. And we had a few people who died from social media theories that were out there.
Wow. So again, be talking to your doctor. Be talking to your doctor before you're doing anything of that nature. So I know that people are anxious with the idea that perhaps when the vaccine is more widely out there, that we can all stop wearing our masks and we can all start, getting back to normal, what we consider normal. What would your comment be about that right now?
I think we want to take it step by step. As healthcare people, we favor perhaps being a little bit more aggressive on the public health measures before we let them up. And I think for me personally right now, I have received both of my vaccines. So I'm fully vaccinated and will have all my immunity in just a couple more days. But we know that the vaccine is 95% effective. It's not 100% effective at getting COVID. And it's possible that people, even though they're vaccinated could contribute to the spread of COVID to other people in the community. So because it's not 100% effective and there's that rare possibility I could get infected and pass it on to others, I still want to follow those public health measures, like trying to distance from people and wearing that mask so that I can do everything that I can to limit the spread. I think, that for me personally, once we get all of our kids back in school safely, our businesses are doing better than they currently are. Then I might start letting up on those public health measures, just a little bit and slowly and sort of seeing what happens. So I think we want to get back towards a conventional society, get our kids in school. And once we are doing better than we currently are, and we know what those risks are going to have to our community, then perhaps we can start to let up on those public health guidances. Though I would always recommend to wash your hands, before eating and drinking and all that type of stuff.
Some good stuff we've learned because of that, right?
I think people are definitely better at washing their hands than there were before.
Yeah, I think so too. So may I ask you, how are you feeling after your second dose of the vaccine?
I'm doing really well. I was outside skiing one day out in the cold, and then I got home and I was chilled, and I wasn't sure if I was chilled because I was outside in the cold all day or if it was the vaccine. So, I was pretty lucky. I didn't have a rash. I actually took my temperature a few times just because I was curious, and I was always 98.6. No true fever at all. So I'm feeling good. I'm sort of in that pool of people who kind of wish I had a low grade temperature, so I knew the vaccine was working for me. But yeah, I have not had any side effects. A few people that I know have had some very mild side effects, but nothing that's been severe. And I have not heard of any severe anaphylactic reactions, at least locally or in the community that I know in healthcare.
Great. Good to know. So then I guess my final question is really, do we know when we're going to be distributing this to the community? We're certainly getting a lot of questions on that. And then do we know what will that look like? And how will people find out that they indeed can go in and get a vaccine?
That's a great question, and probably maybe the most exciting one. We are really dependent on the state and the federal government to tell us when we at Bellin Health can start to vaccinate the next groups of people. We're not able to independently make those decisions and use the vaccines that we have to move on to the next pool of people. We need to wait for someone to tell us that it's okay to do that. At the same time, just before we did this recording, I saw a media release from the governor's office saying that starting on January 18th, that the state's going to allow some of those people in the 1B priority group, mainly law enforcement and firefighters, to start to get vaccinated as the next frontline people to be able to receive the vaccine. So we're moving forward. I have to imagine that things will, sort of ramp up really quickly. I think a lot of people kind of feel like things are moving like a snail right now, just so slowly. But I think it's going to start to ramp up really quickly over the coming weeks. I would encourage people, if they have a MyChart app on their phone, or even if you don't, you should download that and get listed, because that's how I was notified that I was eligible for the vaccine. And there will be a lot of information that'll be pushed through the MyChart app. And then, of course, just the local media, we're in contact with them very frequently. There will be a lot of information that continues to come out over the coming weeks and the coming months about when each priority group will be able to get the vaccine. So it's just sort of like a stay tuned and just, be watching the news and following your MyChart app.
Perfect. It's an exciting time, and there will be a lot of publicity when it starts to roll out. So I'm sure that people will definitely be informed, and Bellin will definitely do their part to keep you informed so that you know when it's time. Any other parting thoughts? Anything else you wanted to share with us today, Dr. Burmeister?
I think we hit almost everything. But I would say that even though this talk was about the COVID vaccine, it's not too late to get your influenza vaccine. So if you have not got that yet, that could be really helpful for us. It's interesting with our public health measures likely contributing. We haven't really seen any influenza at all in our region or even across the country. We've been doing a lot of testing. Actually, a lot of the tests we do for COVID-19 actually have a panel on it that includes the influenza virus. So a lot of people who get tested for COVID also are being tested for influenza if they're going to be hospitalized. So there's a lot of influenza testing out there, and we're just not seeing cases yet. So it just sort of shows how potentially infectious COVID is, compared to what we know as influenza.
It's really exciting, because maybe at the end of all this, we've learned how to take care of our health even better. That we'll have less influenza and all sorts of things, just because we're more cognizant of those health measures.
Yeah, absolutely. We're always trying to get to a better form of you, I think, is one of the sayings we have.
Yeah, awesome. Well, thank you so much for your time today, Dr. Burmeister. We really appreciate you answering all those questions. And as always, we really encourage you to reach out to your primary care provider if you have questions specifically, with your own health. I think Dr. Burmeister always likes to give us the reminder too, we are here for you. Please don't wait until you're feeling overly sick. Our doors are open. We're taking lots of safety precautions. please continue to seek out care, because we definitely want you to take care of yourselves.
Absolutely.
So that'll be it for today. Thanks again. And also for more updates, watch your email, and you can always also tune into the bellin.org/COVID-19 website for more information. Thanks so much, everyone.